Welcome everybody to another edition of the Kansas State Veterinary Diagnostic Laboratories webinar series. It's good to have you all join us today. I'm Greg Hanselchek and I'll be the moderator. Just a few things to go over before I introduce our special guest for today's webinar. One is that our webinars are scheduled to run an hour long with about a 40 to 50 minute presentation and then the end left for questions. So please, if you have questions during the seminar, please put them in the chat. If by chance you have maybe an IT or communication issue that you need help with or think it's coming from our end, please put that in the chat also. If by chance we do not get to your question by the time the webinar ends, please feel free to contact our presenter for the day. At the end, there'll be some contact information and ask them the questions. Or if you have questions down the road, a month or 2 months or 2 years down the road, feel free to talk to our special guests. Number two is this within a week or so, you will be sent an email with a certificate that indicates that you have earned 1 hour of CE credit if you stay with us for the whole hour. These webinars are recorded, and one of the recordings we plant on the Kansas State College of Veterinary Medicine Continuing Education website. You can go there. There'll be a few questions little test you have to take at the end. It's free, but you'll also earn an hour of CE credit there. We also plant this on our YouTube channel. We have lots of videos there. If you just Google KSVDL YouTube, it'll come right up. If you watch it on YouTube, you will not get an hour of CE credit, just so you know. Also at the end, we will ask you to fill out a survey. It's a very short survey. Kind of ask you what you think went right. If you think there's things of the webinar that we could do better, then please let us know that. The most important thing that we'll ask you is what topics do you want us to cover as we go forward? We want to put on these webinars multiple times during the year, but we really want to provide topics that you as practitioners and veterinarians are interested in. And then before I introduce our guest, I want to give thanks to the 5 and more IT and communications people that are in this room and other places that without their help and expertise, I guarantee you this would not happen. So thanks to them for helping us out. So without anything else, I'd like to introduce our special guest. It's my privilege to introduce Dr. Scott Fritz. Scott is a Nebraska native. He graduated from Iowa State with a DVM in 2014. He then spent 5 years in a beef practice in South Dakota before deciding to come back to academia to pursue a residency in toxicology under Steve Ensley. And during that time as a resident, he actually became board certified in toxicology, which is very cool. We're very, very lucky to have him as part of our faculty here at College of Veterinary Medicine. He is now finishing up his PhD in toxicology and will be joining us as already a professor, but as a full-time professor when he's finished with his PhD. So with that, Scott, welcome. Thanks for being here today to talk about lead in bovines.
Yeah, thanks, Greg. So lead poisoning in general is one of the most common toxicoses we actually have in not only beef cattle, but in, across our veterinary species in general. There's some considerations, I think, in a food animal species that we need to, kind of take into account as opposed to an individual companion animal. In the case of cattle, we've got animals that are going to enter the food chain, and lead's a fairly significant human health risk as well. So this presentation is sort of geared, there's some clinical background in there with clinical signs and therapy and that sort of thing, but I'd also like to spend some time going over some of these considerations and why, when we manage cattle as a group, oftentimes they're exposed in a group, and so there's more than one animal exposed, and there's some things we need to just work through. And so that's sort of the perspective of how this presentation is going to go. So to start, I just want to give some quick background. Dr. Hanselchek covered it fairly in detail, but just wanted to provide some more information there. So as he said, I'm a Nebraska native. I did my undergraduate work at Hastings College in Hastings, Nebraska. It's a small private school there. I got a bachelor's degree in biology and then immediately entered the combined program with the University of Nebraska and Iowa State's veterinary program. So with that, you do 2 years of your classroom and laboratory work in Lincoln, and then spend the third year at Ames, and then do the clinical rotation at the teaching hospital there at Iowa State. Graduated there in 2014, and then moved to rural South Dakota and spent 5 years in private practice. Most of that practice was almost exclusively beef cattle. 70% of that ballpark was cow-calf work. We did have some feeding clients, not the big intensive systems that you'd see in western Kansas, but did have some feeder clients, and then performed regulatory services for a pretty busy auction market there in South Dakota too. So, that it really aligned there with my interest looking at the residency program at Kansas State. Dr. Ensley is a pretty well-known food animal toxicologist, and the case submissions for our section are about 85% bovine in nature. So, the interest kind of aligned there for me, and it was one of the reasons I decided to pursue that residency program. So that was a 3-year program, and after 3 years of specialized training, following 5 years of practice, I passed the certification exam for the American Board of Veterinary Toxicology. That was last summer. And then after the board certification, like Dr. Hanselchek said, I accepted a faculty position in the Department of Anatomy and Physiology here at the College of Veterinary Medicine. And the bulk of my job is diagnostic service, so I spend a lot of time on the phone with veterinarians and producers, working through case histories, kind of guiding sample selection, testing selection, how to submit samples. And then I've got a fairly decent teaching appointment too, teaching toxicology to the veterinary students, both in the core curriculum and then some elective type courses, and then again in the diagnostic medicine rotation in the 4th year. So enough about me. I wanted to spend a little bit of time on some background in lead. So this is going to be a review for basically everybody, but I think it's important to kind of start where it started, and hopefully by the end of this we'll come full circle and kind of address some of these things at the end of the presentation. So lead's a naturally occurring heavy metal. It's present on the Earth's surface and the crust. It's basically everywhere at this point. The chemical symbol Pb always frustrated me. In undergraduate studies, it's a lot like potassium. It just doesn't make any sense to abbreviate it that way, but it is what it is. The disease state or toxicosis of being poisoned by lead has been called plumism. It's a kind of a take on the Latin word plumus, which means lead. And that's the Roman Empire is kind of the first group historically to really use lead on a commercial level. So you can tell it's been around for a long time. Humans have used it for a lot of different reasons. It's soft, it's malleable. We can make it into different shapes. It's pretty resistant to wear and tear. So it's, the Romans used it to line their aqueducts, which is where the word plumbing came from. They used it in cooking utensils, pots, and everything else. They also found that it enhanced the taste of the wine if they used it to line the wine urns. And so that taste enhancement, it's been described as sweet tasting, and some of the other sources we're going to look at are actually lead salts, which can be attractive to livestock. And you see on the slide there, grapes are acidic, so the grapes they use to make the wine, and we're going to talk about an acidic environment being necessary to ionize lead to make it absorbable. And so all of those, if you look back, some historians will even associate the fall of the Roman Empire at least partially, and will blame it on lead poisoning from all of this enhanced use. The first disease, I think, was identified in Germany, 330 some years ago. Don't quote me on it, but I think there was a monastery associated with a city, and there were some disease processes going on within the city. And the individuals that were in the monastery, they kind of figured out that it was a wine urn that was kind of the basis of that. So it's been around a long time, been a problem for a long time, and we really don't ever get rid of lead. We just move it around. And so I think to start with, just knowing that it's everywhere in the environment is kind of where we're going to start with this. So not unlike basically all metals, the physiologic form of the metal really drives absorption or bioavailability. There's both inorganic and organic sources, and I've kind of got them broke down there going down the slide, but there's a ranking there. Metallic sources of lead are the least available. The lead salts there in the middle, followed by the organic, are the more available sources. And so the inorganic sources, the lead salts, are what you would find in a lead plate battery, which is the most common source we see, at least in this diagnostic lab. Some of the organic sources are the ones you would find in petroleum products, leaded gasolines, lubrications, crankcase oils, some of those different sources that way. In the United States, there's been some, legal remediation of lead use, phased out of gasoline and some automobile products in the 70s there, and again in leaded paints there in the 70s. So it's, we recognize it's a problem, and ever since some of that legislation came out, the incidence of lead poisoning has dropped considerably, but it does still happen. I think with leaded paints, I do get a lot of questions on how do I tell if paint is leaded or if it's not. And they do have at-home test kits that you can buy, I think, at Walmart, Walgreens. They're pretty easily identifiable, easy to find, and they're pretty cost effective. Sometimes you can tell grossly. A lot of lead paints are kind of notorious for this alligatoring, they call it, which I think is a pretty apt description of the way the lead paint is cracked in that image there. Some of those paints also will come off in a dust form, so you really can't tell just by looking at it, but there are test kits at home, which again I think is a great place to start, at least when you're trying to identify sources in clinical cases. So sources for us, they're not really ranked on that list, but they kind of fell that way. I think it's important to note that lead's pretty ubiquitous in the environment. We do a lot of lead testing in this diagnostic lab, and very rarely do we ever find a sample that has no lead in it. Almost everybody and every animal has lead circulating in their system in some degree, and the big driver is the dose, right? So as long as the blood lead stays below a certain threshold, you're not going to see clinical signs, and there's just a natural background concentration that I think is important to recognize. The number one source for us, at least in cattle, in this diagnostic lab, are lead batteries. So that top image, you can just see the casing for that battery is removed, and you see the stacks of plates in there. Those are a metallic grid that's got lead basically imposed and inebriated into those lead plates like that. And if you look in the bottom image, you can see an automobile battery where the casing is cracked open, basically gone after a couple of years of weathering. And that the gray plate on the top, you can see there's little pieces missing out of there. That's the size of the lead particles that would come out of an animal consuming the plates out of these batteries. And again, this is lead salt, so it's somewhat attractive and it's got a sweet taste. And then you stack that with a young calf that's just not a, kind of an indiscriminate eater. You can see how these things are going to line up and actually be attractive to livestock. We do run into cases with lead-based paints a lot of times. These are older buildings, dilapidated buildings, and you see also roofing material, linoleum. Some of those building materials have traditionally had lead in them. And when those buildings are meant to be destroyed, a lot of times somebody's going to dig a hole next to the building, push the building into the hole, and either bury it or burn it and then bury it. The lead's not going to go anywhere. It's still going to be present there. And so it's just important to recognize some of those sources. When we talk about therapy, the first thing we got to do is remove the source. And so I think it's still important to recognize some of these. The lead shot, there's a couple case reports actually of shooting ranges where they did, trap shooting where there's a cornfield on the backside of that. And the lead shot from the trap ranges gets embedded in the corn stalks and into the corn cobs. They chop those fields for silage then, and as that silage ferments, it's an acidic environment. The pH is typically under about 4.5 in silage as it's going through the fermentation process. And then as that's fed to cattle, you've got ionized lead in those sources, and cattle can consume those. And there's been a couple case reports where they found lead shot in the GI tract of cattle or in the feed bunk. It's just not really a source you would necessarily think of. You do get questions, or I get questions a lot about lead embedded in tissue, like if an animal was shot with some sort of lead projectile, is that going to contribute to lead toxicosis? Remember, it's got to be in an acidic environment, so lead embedded in tissues in general is going to be physiologically inactive. There are some weird cases where if it penetrates a joint capsule or goes, into the abdomen, into the GI tract, could be a source of lead. But for the most part, it's typically not going to contribute to clinical disease. The second to last one there, pottery, I've got some data from an actual case where there was some flooding one year in an animal pen, kind of historic flooding. Uncovered some debris that nobody knew was there. There was some clay pottery within that, and some of the glazes used on those old pottery, the sources of pottery, they can contain lead, and we had a pretty significant exposure there. And again, I'll show you some specifics on that case coming up. Then, of course, pesticides. We had some lead arsenate pesticides in use generations ago, but we still run into kind of depots of those in the back of old buildings, old barns. So it's important, again, just to recognize that those still exist, and they're very concentrated. They're percent quantities, and so they can be, again, a significant source for us. So I'm going to kind of beat on kinetics quite a bit today. I think this drives a lot of our decision making if we've got a group of animals exposed, and why you can't really just make a blanket statement, and you need to handle those cases on a case-by-case basis. So we talked about physiologic form. Even the physical form of lead is going to drive its availability. You think about one giant piece of lead in the GI tract isn't really going to be that easily absorbed, but if you've got multiple little particles, there's a lot more surface area. That lead's more easily ionized and able to be absorbed. Route of exposure can be really important. Most of the time we're dealing with ingestion, but in cases where you've got lead paint that was lit on fire, now you've got ash, we can have some inhalation exposures occasionally. And really the big one for me is the age of the animal. We're going to look at some epidemiological data here that's, a bunch of retrospective studies showing that the most affected animals are almost always 2 months of age. They're just really way more efficient at absorbing lead than an adult animal would be. So again, the most common form is ingestion for us. We need lead to be in an acidic environment to be ionized, which is what the GI tract is all about. Lead's absorbed, and 90% of that is bound to the red blood cell. So from a diagnostic perspective, that's why we measure whole blood and not serum. We need the red blood cells in that sample to get an accurate feel for the lead concentration in there. It's going to be widely distributed into tissues, and then at some point it's going to be deposited in bone for long-term storage. Many metals are going to substitute for other minerals within, there's some interactions there, and lead is notorious for substituting for calcium. And so it gets stored in bone and can be a significant storage depot, later on if bone's remodeled, different physiological states of the animal. If you've got a pregnant cow that goes into gestation and starts lactating, she could mobilize a significant amount of the lead out of the bone into her blood, and it actually will partition into milk pretty efficiently, and you can have some exposures to nursing young from that as well. So it's really timeline dependent, which is pretty frustrating to work out from a kinetic side. But you kind of figure 90% of the body burden is going to be present in bone, and then it complicates things when you try to figure out all these different pools together. So lead that's absorbed into the bloodstream is going to be eliminated in the urine and bile, and of course if it's not absorbed in the GI tract, then it's going to go through and be excreted in the feces. And so all of these together, the rate from absorption from the GI tract combined with excretion, those things are all going to interact, and that's the real challenge with kinetics. And so I hope this slide will at least show that a little bit more in detail. So this is the case that I was just talking about with the pottery. These were 2-year-old bulls that were meant for sale. They were exposed. This was, again, some unprecedented flooding had uncovered some debris in the pen, and it was mostly clay pots. We never did get a sample. The producer was pretty on top of it. He reburied those pots and never did have an additional case pop up. So we're pretty suspicious that that's the source, but we weren't able to confirm that in this case. They had some acute onset of neurologic disease in multiple animals. At least one animal died, and we were able to confirm lead poisoning in liver and kidney. So we'll talk about that more in depth in the diagnostic side of this. But this was a unique case that we were able to perform serial blood lead testing on 2 bulls that were clinical with neurologic disease, had apparently recovered. One of those bulls actually relapsed about 3 weeks after the initial exposure. But if you look on the table on the right there, I didn't include all of it, but this was the first exposure happened in June, and the last blood lead we had was in November. But if you look that first month, those blood concentrations actually go up, and they were not clinical in July. And so, we've got some thresholds to try to establish lead poisoning, but they're not 100% related to clinical signs. And then they drop significantly there, 6 months after the fact. We're going to look, some states actually, this is a reportable disease, and they won't let animals leave the premises until they get below 50 part per billion. These are all part per million levels, so it would be 0.05 part per million is kind of the legal threshold in some states. And you see 6 months later, those bulls were still about triple that threshold and would not be able to leave the place. One other thing, you notice that the bull with the highest concentration alternates between the different months. These bulls were very similar genetically. They were the same age. They were fed and managed the same. And so, very similar animals with that kind of variability in a short amount of time. I think it just goes to show how variable this can be when we're trying to talk about, if you've got pregnant cows versus young calves. This is all going to introduce some variability and gets really frustrating in trying to make recommendations in these cases. Again, this case was unique in that we were able to do necropsies on these animals 6 months after the fact, and we did some tissue analyses with these. And when I say tissue analyses, we took 45 or 50 tissues from each animal, multiple muscle samples, internal organs, multiple bone samples. And not unsurprisingly, the bone was by far where the most lead was present. The liver and kidney and spleen they had some, but it was still pretty low, and then it was nearly undetectable in all the muscle samples that we looked at, which is a good thing for human exposures and edible tissues. I know this gets a little bit text heavy. There's 2 references on the top and the columns go with that, so I've just kind of highlighted those and we'll go down through the bullet points. This first paper is just trying to look at bone or blood and tissue correlation to see if there was really any correlation there. They had 13 animals with a confirmed exposure. They found out that blood concentrations were correlated with bone, liver, and kidney, not surprising. It's important, I think, to note that brain, muscle, and GI content were not really reflected, or the blood concentration didn't really reflect the concentration in those tissues. So it's important, this is really a neurologic disease in cattle, so if only brain is submitted and we've got some maybe histologic lesions with that, we can't really measure lead in the brain, and so we really need liver and kidney in post-mortem cases. And again, the muscle, it doesn't correlate with blood concentrations, which makes you wonder why we have the recommendations that we do, and so we'll again work through that towards the end of today. So the authors of the paper on the left recommended animals with greater than 25 part per billion in blood be withheld from slaughter. I've already mentioned in many states it's actually 50 part per billion. And then I think a good recommendation is to not let bone, liver, and kidney from exposed carcasses enter the food chain. The paper on the right, I think you'll notice a lot of the authors are the same. These were 9 farms with accidental exposure, a total of 126 animals. They had a table within the manuscript, and most of the sources were paint and batteries, very similar to what we see, at least at this diagnostic lab. I've highlighted that number, the 11 out of 94. So 94 of the 126 animals they tested had elevated blood lead. Only 11 of those showed clinical signs. So when we talk about recommendations and exposures, I think it's important to recognize, there's a substantial portion of exposed animals that don't show clinical signs, and we really need to do some testing on potential exposures just to get a feel for the severity of what we're dealing with in order to make some educated decisions about what to do with these animals going forward. So the point of that paper was try to identify a half-life in blood. You can see I've highlighted it there at 135 days. The range was pretty substantial at 3 days to a year and a half. If you remember from pharmacology, it's going to take 4 or 5 half-lives to eliminate that compound completely. And remember, this is only in blood. So 4 or 5 half-lives of 135 days were a year and a half to 2 years potentially, which goes along with the case I presented with the bulls. 6 months after the fact, there was still substantial blood lead left in those animals. They also presented some data from other manuscripts within that paper, and if you look, that range is pretty substantial, 9 days to almost 7 years there in some other papers. They did find that lactating animals, the half-life was the shortest, which makes sense when the lead is going to partition into blood. It's another excretion mechanism that non-lactating animals will not have. So mechanism of action, I don't really want to belabor this point. It's kind of complicated and there's a lot of different things going on. The important thing to take away is this is mainly a neurologic disease in ruminants. It's got some effects on neurotransmitters and the way that they're released. There's some effects with calcium that's going to affect action potentials and that sort of thing. Some of those lead salts can be caustic. The gastrointestinal signs are usually vomiting, diarrhea, potentially some anorexia, depending on the species. And then some fairly significant effects on heme synthesis that can really drive some anemia. It's more of a companion animal thing, but again, just the variability on how lead has multiple effects within a living functioning system is pretty wild. There are some renal effects on some membrane pumps, and you can get some lesions with that. It's typically associated with younger calves, but again, we'll look at those specifically moving forward. I do want to call your attention to the kind of different clinical presentations. I realize not everybody just does purely beef work. So in ruminants, this is generally a CNS disease. Cortical blindness is almost a hallmark. Dogs and cats, you get more of a GI component to that. Again, it's vomiting, diarrhea, some anorexia with that, and can get some neurologic signs. The waterfowl exposures have dropped quite a bit since it's not legal to use lead shot in waterfowl production areas or for waterfowl hunting, so that has cut down on those exposures considerably. We, at this diagnostic lab, actually see quite a bit of at least lead-positive raptors, and it's more of a wasting syndrome. That could be a combination of, you know, the CNS effects and they don't eat, but also the GI effects and some other things associated with that. So I did pull 3 retrospective studies. They're in actually 3 different countries. So the table is from a Canadian paper. There's an article in JAVMA looking at diagnostic labs in the United States. The point being, then there's, I guess, another one in the UK. They've taken diagnostic case reports and sort of done some epidemiological work. And I think what surprised me, I think, is a lot of the things that they talk about are all the same. And I've highlighted them here for you. So calves are most commonly affected. The Canadian paper said calves under 2 months of age. The JAVMA article was 6 months and younger. And there were some differences in how they broke those out. Again, the reason for that is more efficient absorption is probably driving that. Those calves can absorb 50% of ingested lead, where an adult ruminant's only going to absorb 2 or 3%. And so a pound per pound dose in a young calf is going to be way more severe than an adult animal. We've already talked about the calcium interactions. And those animals on a milk diet are used to absorbing calcium, and lead is going to substitute for calcium and be absorbed efficiently. Lead and iron are also going to use the same uptake mechanisms, and there's almost no iron in milk. And so those pumps really don't have to compete. Lead and iron don't really compete for uptake, so it's more efficient again in a calf. Then they've got some underdeveloped metabolic systems. They're just not able to handle exposures. That would ring true for infectious disease as well. Behaviorally, though, also, these calves are, again, it's not unlike a toddler or a young puppy. They're going to explore their environment, put everything in their mouth they shouldn't, and kind of some indiscriminate eating habits associated with that. Apologize, my throat's going dry. Angus cattle were kind of more representative in at least these submissions. That's probably a lot just driven by the overrepresentation of Angus cattle in these countries. I think it's important to note that most exposures were in pastures rather than confined to feeding settings. I've got some cases here where animals were in confinement, but most cases, again, are on pasture settings. And the month of exposure will go along with that. So the table on the right, the x-axis is months, and the y-axis is going to be just total cases. That was a 16-year retrospective study. They had, 500 and some cases. And again, most of them are going to be there in the summer, which fits with young calves in pasture. Interestingly to me, so there's acute and chronic forms. The acute form is definitely most common, and this happens after a high dose exposure rather than chronic low doses over time. And the onset of disease is 12 to 24 hours, which is a little bit different than a lot of people think. As a metal, I think there's a common misconception that it takes a while after an ingestion to have clinical signs. So this slide, hopefully the volume doesn't come up on this video. This is obviously an older animal, almost at the end of a feeding period. So these were animals that were being fed for harvest. Again, it's a primarily neurologic disease. You can see some of initially there was some ataxia, there's some muscle tremoring there in the hind limbs, and then this animal eventually goes recumbent. As I mentioned, cortical blindness is kind of a hallmark when you've got, really in cattle, if you've got blindness whatsoever, I think lead is an appropriate rule out and at least needs to be looked at given its human health implications. This bruxism or teeth grinding is also pretty common. Some of those other neurologic disease may or may not be present. So a little bit different animal here. This calf is actually blind and he didn't know there was a pond there. We talk about aimless wandering sometimes with CNS signs. That's a lot what this would look like. He couldn't see the pond. He actually can't see the videographer there, walks right up on him, doesn't know he's there. And so the blindness is very real, and it can be pretty significant. Also, a young calf like this, there's no other cattle in sight there. He's got no idea where he's at. And so it's, kind of variable presentation depending on lots of different factors. And I think the variability is one of the things that that is important to note with lead exposures. So this calf, actually, we ended up being able to do some of the testing. His blood lead was over 0.65 part per million. Again, we're going to look at the diagnostics, but anything over about 0.35 part per million is consistent with exposure with toxicosis. And any tissue level over about 5 part per million is pretty significant. So this was kind of a well-made diagnosis and just shows some of the more minor neurologic signs rather than the acute convulsive death that we sometimes think about in young calves. So this can be also somewhat nonspecific clinically, and so from a necropsy perspective, you may or may not see anything grossly, and often nothing is pretty common. Remember, the acute onset, we're 12 to 24 hours in general. Oftentimes there's just not enough time for at least substantial gross lesions to appear. You may see some nonspecific changes in the CNS or in the kidneys themselves. One of the best things we can do is actually do a pretty thorough look through the GI tract. You can see from the image there, that's a reticulum, all the lead particles in there. That's pretty helpful in identifying the source a lot of times, but occasionally, depending on what form we're talking about, if you've got a lot of small lead particles, they may hang up here. And if you've got paint exposures or dust, you're not going to really see anything. And then from a treatment perspective, one of the things we have to do is eliminate the lead out of the GI tract, or it's just going to be continually absorbed over time. And really, how would you do that in this situation, especially on a group exposure to multiple animals at the same time? It's kind of frustrating to think about, and I think what really drives some of the extended half-lives that we see in cattle is they just have this mass of lead in the GI tract that we can't get out, and it's just a constant source for absorption over time. So just for perspective, this was a reticulum dumped out on a paper plate, and you can see there's some gravel and sand in there, but there's also sort of these square column type shapes of metallic material, and then you've got some of these smaller lead particles. When you've got pretty square edges like that, it's pretty suggestive that there's at least something that's not natural in there. And so again, just think about it. If you had to eliminate this out of the GI tract of a 1,400-pound steer, how would you ever get that accomplished? And that really is what drives some of the problems we have in food animals. So after a necropsy or even prior to, we can make some analytical diagnosis for lead. Antemortem, again, we need to use whole blood. I've got a normal range there is typically below 0.1 part per million. We've talked a little bit that some of the regulatory agencies make it be below, it would be 0.05 part per million. But the toxic range is quite a bit higher than that. And again, the calf on pasture was 0.65 or almost double what the toxic level would be. Post-mortem on histopathology, I think, is really frustrating on some of these cases. Again, it's acute. A lot of times you don't see any histologic changes whatsoever. And so if you've got an unexplained death in a calf and you try to do histopath and you don't find any lesions at all, it's really frustrating for both sides of the diagnostic lab and the submitter in that case. But some of those cases may warrant some lead analysis, and it's pretty easy to do with liver or kidney. And you can see that there's normal is under 1 part per million. Again, it's rare to find an animal that doesn't have at least some in the system, so there's just a general background concentration we have to deal with. Toxic concentrations are going to be over 5. You saw, again, the calf on pasture was about 18, so most of them are pretty significantly elevated above that. Our diagnostic lab uses the instrument in that image there. It's an ICP-MS, inductively coupled plasma mass spectrometer. And so we're able to go down to part per billion concentrations in multiple different biological tissues to make this diagnosis. And they're obviously that machine's quite a bit more sensitive than the point of care analyzers that you could purchase for clinical use. So kind of to illustrate some of the frustrations with the histological findings in these cases, I just went back to last year. I just did a search from April to May, pulled out the first 2 lead cases I can find, and they're kind of summarized here. So again, these were submitted in April. That case 1, 45-day-old calf, under 2 months of age, just like we'd expect. There were 100 of them in the group. He had one dead one yesterday, kind of unexpected or unexplained death. Didn't really do anything until the second one. Noticed her seizing. She died in about 20 minutes. So we submitted a pretty robust workup. I don't have the tissues listed there, but there were really no microscopic lesions identified anywhere in that calf. But with the neurologic signs associated with that, we did do a liver lead, and you can see there it's about 4 times what the toxic concentration would be. Background should be under 1 part per million. As opposed to case 2, there were a couple calves and actually a cow affected. A pretty big operation, but they had kind of a subset of those, 25 head of pairs in a confined feeding setting like that. 2 calves had some neurologic signs. Again, circles typically, at least suggest some neurologic involvement there. Histopathology, there was some neuronal degeneration there, and you can see it's mild and it's acute, but at least it was there. And again, these, doing a liver lead on these cases, 11 and 15, which is again 2 or 3 times the toxic concentration in liver. So just goes to show you can't rely on histopath all the time, and especially in cases where there really is no diagnostic findings and unexplained or sudden death, I think lead's an appropriate rule out, especially in young calves like this. So this is kind of a generalized treatment goals, kind of across all species. So I think the most important thing that we need to do is remove access to the source, and the first thing you need to find it. And so I think necropsy can play a really good role in that. If you can look in the GI tract and at least see what the source looks like, then it might help you find what it is. There's a lot of times where you don't find the source itself, which is really frustrating because you may have animals that experience clinical disease moving forward. The next step is to get the source out of the GI tract. It's a lot easier if it's one big object versus the small particulates that I showed you in the reticulum images earlier. Oftentimes not practical in a group of food animals, right? And so it's, that's kind of a hallmark of therapy. And then you can do some chelation therapy. It's more of a companion animal thing again. 90% of it's in the bone, and some of the IV chelators are actually pretty good at pulling it out of the bone, and they'll enhance excretion that way. There's also oral chelators. They really won't do anything for the lead stored in tissue. It's just to enhance excretion out of the GI tract. But it's important to note that this is kind of an all-species recommendation, and when we move over to food animals and ruminants especially, it's really hard to recommend therapy in a lot of these cases. So the first one is there's a poor response to chelating therapy, and so there's, remember there's typically a whole bunch of lead stuck in the GI tract somewhere, and if you try to chelate the blood and the bone, they're just going to keep absorbing it from the GI tract, and you're really not going to get anywhere. Anorexia is one of the hallmarks of this disease, especially in those animals that have pretty severe permanent neuronal damage. You may not be able to even manage through that. There's a lack of FDA-approved chelators, like there are none for food animals. We've got tissue residues of lead, not only lead, but also the chelating agents can be residue problems. And then that bone deposition really throws in a problem too, as it's another source of potential, it's not really absorption, but mobilization that you need to think about when you're trying to develop a kind of a treatment plan. So traditionally, calcium EDTA has been the chelator of choice. The dose is provided there. The real problem is EDTA is not on the list of approved substances for compounding from bulk, and so it shouldn't be used in food animals, and you would need to call FARAD and again get a withdrawal, but in most cases it's not practical to do that. Again, it's not going to do anything for what's caught in the GI tract, and so you basically went through all of this for nothing in a lot of cases. The FDA might even tell you that those carcasses are never fit for consumption, and so it's hard to recommend doing that at all. Thiamin's been used at 2 to 4 milligrams per kilogram per day sub-Q. It's a general neuroprotectant. It has shown some benefit in lead encephalopathy cases, so certainly appropriate to give some of that. And then magnesium sulfate you can use per os as more of a trying to eliminate what lead is there out of the GI tract, but that's going to get ionized molecules. It's not going to move those big physical sources of lead out of the GI tract. And so honestly, what it comes down to a lot of times is just giving these animals time, which can be frustrating and expensive from both a producer and a veterinarian standpoint. So just some of the considerations I think it's important to take into account is this is a reportable disease in some states. It's not in Kansas, and many of the surrounding states it's not, but if you get east of the Mississippi, some states will actually put a full quarantine on exposed herds. They make you do serial blood measurements until all animals are below that 50 part per billion in whole blood. And so that, it's going to be pretty costly if you've got, say you've got 100 animals exposed and you have to bleed them 4 times a year. That's going to add up pretty quick. not to mention the feed costs. If you've got animals meant for consumption that are 1,300 pounds and you have to bleed them and feed them for a year and a half, like it's just not practical. And so it really is a case-by-case basis on what the best recommendation is. And I'll show you a case here where, it's kind of an unfortunate end to the thing. I just wanted to put some perspective also on the 50 part per billion in whole blood in a food animal is going to compare to the FDA regulations on contaminated food products. So again, it's ubiquitous. It's pretty much in everything we consume all the time. They've got a limit of 5 part per billion in bottled water. You can see there 10 part per billion in this. This is for food meant for babies and young children, but it's 10 part per billion in most of the mixed foods and 20 part per billion in dry cereals, just showing you how that compares with their, the kind of regulations in blood in a food animal. And so sometimes you have to get creative and find some other alternatives on how to utilize these animals. You can potentially make breeding animals out of some of them. But again, it's important to note if you've got, say, a developing heifer that was exposed, she's going to have pretty significant bone deposition. She goes to calve for the first time. As she goes into that first lactation, could mobilize a significant amount of lead from the bone. It's going to end up in the blood. It's going to end up in the milk. And you may have an exposure to a fetus from that, or she may even go clinical at that time. And so again, a case-by-case thing, and you just really need to work with veterinarian diagnostic lab and the appropriate authorities to figure out how to remediate these situations. So the last thing, I just wanted to show a pretty severe case here. This was just for some context. The producer was gone for a couple days. He came back and there were roughly 85 head of fed cattle. So this was the same case of the first video I showed. These cattle were getting towards the end, almost fit for slaughter. He had 85 head of animals that were in various stages, had some dead ones up to some minor muscle tremors. Working through the environment, he noticed some debris in the feed bunks. You can see on this side, this is a battery terminal, and then these are all the lead plates, presumably out of a battery. And as you start looking through the feed bunk, you can see all the debris they were able to find. You see these gridded lead plates is what they were. And again, you can see the casing in some of this, and that's, remember, lead's pretty soft and malleable. So this is what a battery looks like when it goes through a grinder mixer like this that we would use to deliver feed to cattle in general. Just for some context, we're talking about 75-pound battery on the front of a tractor. And so we do run into cases sometimes, these things weigh, again, 75 pounds. They're not that easy to handle. So, you may pull up with a skid steer bucket with a new battery sitting in it, swap out the old one, put the new one in, park the skid loader, get back in the tractor, go feed calves, and then the next day forget that battery's in the bucket. And we've seen this happen more than once where, the old battery's sitting in there, go and scoop up feed, put in the mixer wagon the next day and forget about it and grind that battery up for delivery to a, in this case was a pretty substantial group of actually fat animals. And so this was kind of the end result. These were home-raised calves that were fed all the way through to slaughter, and so you can imagine the, financial implications of that and really even the emotional implications that this producer had to go through. So, we talk about lead being ubiquitous in the environment. We don't really ever get rid of it. All we do is move it around, and I think this case just goes to show that we've got significant lead exposure in these carcasses, and now they're underground, and we've got some more environmental contamination for that. But burial is one of the accepted forms of disposal, and so that's, I guess, how this case ended up. So with that, I've got some contact information there if you need to get a hold of me after the fact, and I think we'll open it up for questions at this point.
Thank you, Dr. Fritz. Outstanding presentation on lead in bovine and other species. Very much appreciate that. I do have a few questions. One, you brought up the case at the end about basically some fats. What if we had a producer with 100 pairs and somebody diagnosed that there was lead poisoning in the group? How many animals would they need to sample to have an idea of what the level of exposure to the lead was?
It's not an answer anybody's going to want to hear of, but the answer is all of them that could potentially be exposed. Because, we go back to that paper, there were 88% of exposed animals were not showing clinical signs. And so to get a real feel for how extreme the exposure was, I think you do need to bleed everybody. And then you can separate them. That'd be my recommendation, is separate those animals exposed, treat them as a different group, and those that weren't exposed, if they're separated and managed differently, there's really no issue with those. So Yeah, I guess the bad answer is all of them, but I think it's appropriate.
What if a producer has a poisoning in their herd and there's an animal they would like to butcher? Do you have some guidelines? I know you talked about states and FDA have guidelines. Are there guidelines that you would offer for them as far as butchering that animal?
There's really no rule. I think that using that 50 part per billion in whole blood is probably a good benchmark. Remember, the blood doesn't correlate with muscle that well, but that's kind of a unique setting. You know, if you butcher one animal and put that entire animal in the freezer, you're going to be exposed to that animal every day. Whereas most people that are getting their beef from a grocery store are, you know, that's a different animal each time they go in and purchase some of that. Without any better information, I think we just got to go with the 50 part per billion in whole blood, and that's really the best recommendation we can make at this time.
So let's say that they want to pursue that, and so they grab a whole blood sample and have the lead level completed. Is there a time span where you would suggest that they repeat the testing just to see what the levels are doing through time?
Some of the states that have the rules will make you do it every 3 months. I think that, you know, in a personal setting could be done more often or less often. Practically, I think it would be best just, you know, if there's certain benchmarks that animal needs to hit, if you're getting close to the slaughter period, you know, it's going to get expensive to feed that animal beyond a certain point. And so, you know, practical recommendations is as often as you need to until you hit that threshold. But keep in mind, it could take months or even over a year to drop that below the recommended threshold there.
So you had a list of the levels that were accepted in certain human foods. Is there a level, or does government agencies, do they screen and look for the lead in some of our red meats or some possible exposures coming from that area?
I don't think they do. Nope. I'm sure that there's situations, you know, it's a case-by-case thing. Again, I don't think there's general screening for that in the packing plants per se. Part of that is just because we don't expect it to be present in muscle. And then, you know, the screening can get expensive for tissue analyses.
Another question we have is, how much does that blood lead test cost?
Oh, we'd have to look at the catalog. I think it's $27.50 for whole blood lead. The tissue's probably pretty similar to that, and then you'd have an accession disposal type fee associated with that. But it can't really add up on those big exposure cases. But you know, a single animal is pretty economical to get that done.
And what can be an expected turnaround time on the test?
The blood lead is basically a stat test. So if it gets to, at least in our lab, if it gets to the lab before noon, it'll usually be run that day, or should be run that day, provided the machine's not swamped. But within a day.
You mentioned earlier about there are some point of care tests out there, and you thought they were pretty good first steps. Just how accurate or precise or sensitive are those point of care tests?
They're a screening tool, so you know they're not meant to be ultra sensitive. There was actually a recall last year on some of those machines. They were given some false negative results. They're probably pretty good for positive samples. I don't know, you know, they may give you some false negative readings, but I think those positive samples should at least be confirmed with a more sensitive method.
Very good. I think that's all the questions we have. I don't see any more questions coming through the chat line. So very much appreciate you being here, Dr. Fritz. And
thanks for having me.
Thank everybody for participating in our webinar. Keep watching out for our emails. We'll be sending you an update or at least a heads up on when our next webinar will be taking place in the subject. So y'all have a good day, and we'll see you next time.